Hello, everyone. We're ready to start. We'd love to start with brief introductions. I'm Anna Navarro, founder and CEO of Fi Networks, investment advisory firm that works with global health network and funds. And I'm pleased to introduce Sheetal Narayani and Gary Goldman, general partners of Global Health Impact Network and Funds. And our guest today, Elemeno Health. I would like the team to briefly introduce themselves, starting with you, Arup.
Hey, so I'm like I think many of the LPs on here, I'm a physician founder of Elemeno and chief strategy and medical officer.
On to you, team.
Great. Tim Coulter, I'm the CEO here of Elemeno. I've been in health tech for quite some time, going on 20 some years, and have been part of Elemeno for about the last year and a half, and excited to talk to everybody today.
Thank you. Nick.
Hi, everybody. I'm Nick Torres, Vice President of Growth and Partnerships here at Elemeno. Like Tim said, really excited for this conversation and appreciate you all joining us here today.
Thank you very much. We're very excited about the conversation as well. And we'll start with you, Arup. And the vision question, of course. What was the original vision behind Elemeno? If you could tell us some of the origin story, would love to hear that.
Sure. The origin, I think, for many of us who are in healthcare, it starts out very personally. And many years ago, I lost my sister to a medical error. That was when I was a child, and it was an experience that stayed with me and continued to motivate me when I went into college deciding what to do. It was, you know what, I want to go into pediatrics. I want to take care of children like my sister and do that in an ICU setting. Eventually, I went through that and went through Stanford, UCSF, Children's Oakland, and all of these really top tier, wonderful hospitals continue to see patients dying from preventable mistakes made by hardworking, well-intentioned, well-educated staff who simply couldn't recall what they needed in the moment. And at UCSF, at the system, I would sit on these RCA root cause analysis committees, and we would look at major events. And invariably, it would come down to, hey, we knew what to do as an organization, but our frontline staff didn't know how to actually do it at the time. But this gap between basically institutional knowledge and frontline practice, gap that was getting bigger and bigger. And we asked, why is it that, here in the Bay Area, it's a technology hub where technology has been the great enabler for us, why wasn't that helping us the same in healthcare? Rather, in healthcare, the greatest manifestation of technology was the EHR, full of force functions and pushing us away from the patients. And in our group, who was our leadership team in the ICU where I was medical director, as myself, our nurse leaders, and our RTs, we said there's got to be a better solution of how can we get everybody on the same page and keep them there in the context of constantly changing information and constantly changing staff. So we had piloted first out with Salesforce. Mark Benioff had donated his philanthropy to UCSF. We use CRM with the idea of customer relationship management technology of how can we think of our frontline staff instead of our employees as our customers? How can we use the cloud to empower them with information in the moment when they need it and use that strategically to give them the right information so they can drive our strategic priorities, which are around safety. We had initial successes there, and we said this is important, too important not to scale. That's what brought us to YC to take this idea and scale it out on AWS as Elemeno Health. So our original vision was around the idea of getting information to frontline people, the real doers, in a way that they can capture it in the moment, in the flow of work, multimedia, bite-sized job aids. We did that, and we found that it improved quality. But we also found then that, and this was my naivete, is maybe I should have hired Tim way back then, to learn that people love to talk about quality, but few people actually want to buy it. Hospitals sadly don't want to pay for it. And it was from there that we went into, and I think I'm touching on, another question you wanted to ask about how this has evolved is we went in with this solution that was improving quality, but not selling. And then in the pandemic, when we had this great resignation of staff and this influx of these new workers coming in who are all, again, digital natives, who their way to communicate and to learn was here in the moment. Then our leader said, gosh, my people learn differently. And on top of that, with social distancing, I can't stick them in a classroom anymore. I've got to really meet them where they're at, which is mobile and all over the place. And so they started using us for onboarding and orientation. And that started to shorten door to floor time. That was hard dollar savings. That got institutions to take notice. And it was, hey, you're driving an ROI, not just a soft ROI of improved outcomes, but a hard dollar ROI that I can directly tie in to my bottom line. And that was for us a change to help us to be able to really grow sales. The other thing that the pandemic did for us is prior to the pandemic, we saw hospitals were generally very insular with their practices. This is my way of doing things. This is my secret sauce. And we were very much of proponents of this idea of how do we learn from one another? Because each one of us is doing variations of the same thing, whether it's in our ICU, it's our OR, it's our ED. And in the pandemic, hospitals realized that, you know what, we really do need to collaborate with each other. There's so much information is quickly changing. Let's learn from another and let's compete on something outside of the best practice. And that really opened the door to information sharing. And for us, that started to really come back to our vision is that here we were giving people bite-sized information when they needed it. That information now, each hospital could put it up on the cloud and other hospitals could grab it and go. So we started to democratize access to best practices, sourcing it from subject matter experts in the community, and ultimately empowering all hospitals to be able to level up. And that was really going back to our original impact of quality, how we could really drive this at scale.
Thank you very much, Arup. And team, you've mentioned you joined over, I believe, a year ago. What was your journey like with the company? What attracted you and what milestones have you seen so far with the company?
Yeah, no, appreciate it. I feel like I've been with Elemeno for a really long time, but it's only been about a year and a half, but we've done a lot in the last year and a half. And I think that the things that originally attracted me to joining the company, originally I met Arup, and obviously you talk to Arup for a little bit and you get a sense for the vision, the passion, and the very real problems that are out there in healthcare. And yeah, sign me up. I'm ready to go. Like this is great. And then the more I learned about the company, the things that really got me excited was how much the customers really actually use the software and enjoy using the software and using the product, using the resources. And I've mentioned in my intro that I've been in health tech for a long time. And a lot of times we create in the industry software that people surprisingly don't actually like using inside of the hospital. I don't know if people aren't always fans of their EHR and using some of the things that are out there. And so to have a type of solution that's actually helpful and that people enjoy using and is driving some of the outcomes that Arup is talking about got me really excited to join. And also combined with the fact that there's not a lot of great solutions that are out there for frontline staff, that we create things in a vacuum with different types of incentives that we have in healthcare without having a true platform for nurses, for those that are at the point of care and are delivering care at the bedside and arguably have an outsized impact on the outcomes that happen inside of a health system. And so that drew me to the company, being able to look at that and then being able to produce true ROI, hard statistics along what we're able to do as a company. That to me is the magic formula for being able to look at a solution that not only can deliver on Arup's vision, but can also have a great business outcome, that we're able to scale the business. When you have customers that love you, you're developing or you're delivering true tangible ROI. And you've got, I think, just a lot of clarity around the problem space that's out there with who needs the solution. And so those are the things that drew me to the company. You asked about milestones too, with being able to come in and being able to build off the foundation that Arup and Nick and others had started here at Elemeno. It was great though, from a business standpoint, we were able to double our ARR last year, be able to have some really great growth. We're now approaching about 100 hospitals that are using Elemeno. So being able to be part of that growth is just fantastic. And that's showing a pretty significant increase in the number of hospitals using us in the last year as well. I think that some of the things that I look for in the last year is we made the Inc. 5000 list for the first time in a company history last year. So that's a great milestone from a business also. But the one that was, I think, going back to my theme around customers, the thing that was most impactful to me is we had our very first user conference last year, where we gathered in San Francisco We had over 50 attendees that represented a huge swath of our hospitals. And what was awesome being able to join was that they presented their stories. They presented how they're using Elemeno. So, you go to a bunch of different user conferences, they can feel like a sales pitch or something along those lines. This was more of a collaborative effort where they were all excited to show how they're using Elemeno. Here's what they're doing. And building on that vision that Arup had about being able to share resources and be able to have this community, you had a bunch of frontline nurses, you had managers, you had CNOs, you had others that were there that were like, here's why we're using Elemeno. Here's how it's made a difference. Here's the impact. And that was a huge milestone for us to be able to have that first user conference. We're going to have another one in the fall coming up that I'm extremely excited for to see how people continue to use it. But those are some of the big things that we have right now. So the growth in the number of hospitals, the growth as a company, and then but being able to see us have just such a huge impact with users has been a lot of fun so far.
Thank you very much. And bringing on to Gary as a clinician and investor, you decided to back the company quite early in its journey. What were the early signs that attracted you to this company? What gave you conviction that it's a good investment opportunity and impactful investment opportunity as well?
Yeah, you can hear me, Anna, right?
You
Yeah.
can hear
Okay,
me.
great.
Thank you.
What's great, because everything that, so far that Arup has said, Tim has said, really embodies what I was trying to create with the network. And that's why they were such a great early investment for us. We've been doing this now for close to 8 years. And my initial mission and vision for the network, after being a serial entrepreneur myself 3 times, was how can we create an ecosystem, a place that actively promotes participation by the health professionals in the innovation process, right? Because at the end of the day, we've all experienced a lot of companies in those early times where companies were raising $25, $30 million, building a product, and then would commercialize it without ever really speaking to the clinicians that actually used it at the point of care in the trenches. And the other part of it that was really relevant to me is, for me leading up to that, I was also a lead informaticist for Sutter Health, a 27-hospital system. And it's been mentioned, the level of discontent with the implementation of, I won't say the name, but that particular electronic healthcare record was off the charts, how unhappy the clinicians were with using it. And this was in the early stages of electronic healthcare record. And it was because there wasn't enough input. Whereas here, Arup came along and had built this platform. And again, we're talking pre-pandemic at the time, okay? And I'm always the first to admit, in a clinical setting like this with the right audience, I'm not uncomfortable saying that the best thing that ever happened to digital health was the pandemic, because it really shone a light and put a focus on all the value that technology could bring to healthcare from an efficiency standpoint. But when it all of a sudden becomes the only way to take care of patients, then you get everybody's attention. And Arup alluded to the fact that pre-pandemic, it was a struggle. And then post-pandemic, it just became a lot more clear to everyone because they were forced to start using some of this technology. But Arup came along with Elemeno with this technology that it wasn't the biggest rocket science concept. It was like so embodied what we were trying to accomplish was, how do we take this technology and give it to the clinicians in the trenches that could make their life easier, could make it simple? Look, as an anesthesiologist who practiced for 35 years, if I had $1 for every time that we were standing on like labor and delivery and everyone didn't agree on how we were doing something, and the charge nurse would say, let's get the policy and procedure manual out. And there would be this half an hour search for this huge loose leaf that was somewhere in the duty room. And then it would come out, and this loose leaf would come out with 1,000 pieces of paper trying to find what we were looking for. All of a sudden, the minute that Arup presented this to me, I was like, I saw the immediate value of providing this tool to the nurses and the doctors and the people who are actually caring for the patient. Because first of all, it improved our ability to take care in the immediate, as opposed to wasting 30 minutes while a patient maybe was getting sicker because we couldn't get our act together as to what we were supposed to be doing. So that was the first part of it. But the second part of it was not just at the clinician level, but at the enterprise level and the value of it. And that's where Arup had the vision right from day one, was not only are we taking the policy and procedure manuals and all this data and putting it into our database. But what about Napa Valley Hospital, the small little hospital that doesn't have 27 other sister hospitals, a Sutter Health environment, to be able to utilize what already existed for policy and procedure? These hospitals were spending a lot of time and effort trying to build their own policy and procedure, and there was no place that they could go to look at, how does the Mayo Clinic do it? How does this place do it? How does that, and access it in a way which would accelerate their ability to create the policy and procedure, but more importantly, bring them up to the standard of care at the time. And technology has gotten us there as well, in that, and again, I love what they're doing now, is they've created this database that hospital systems can use to improve their ability to deliver this kind of information and create it. Every step of the way, what Arup built embodied what I was trying to achieve. And then we fast forward to now, and they've made so much amazing progress, and how they're taking that technology and expanding it in a way that benefits everything from the provider and the patient at the point of care, all the way to the top of the enterprise, and even inter-enterprise collaboration as well, which is really a very important part of our network as well.
And then thank you very much, Gary. And then bringing into network, to tell onto you, you made the investment. You also were involved in making the investment decision from the CFO perspective, and really pure on the investment basis. What gave you comfort early on? How did you think that this company will scale and grow and will actually make a great investment for the fund?
Elemeno and a couple of other companies that we invested in were some of the companies that I evaluated very early on in my career at GHI and NF. So I came with a background of corporate finance, working in pharmaceuticals, fresh out of Stanford Business School. So 15 years completely in pharma. And I'm looking in the VC world at a startup in the healthcare sector, which is more software driven, has no revenue. And I'm supposed to evaluate. And I'm like, wait, why are we investing? This doesn't seem traditional thing that we would invest in. So what is going on here? What am I missing? So before even assessing Elemeno or doing the due diligence on Elemeno, I had to work on myself to change my thought process. I came from a very typical corporate world thought process. So I had to change my mindset. Look at what is the market they are targeting. What is the real need? Talk to clinicians, talk to subject matter experts. Is this something that you see? The issues that Arup and Gary are raising, are these something that even do you also experience? Are we looking at it in silo? And that's when I discovered the problem is really huge, and it's not really being addressed, which honestly is surprising. You would think such a major problem which is not such a, doesn't have a very difficult solution, would have been implemented years ago, decades ago, but it hasn't been done. Arup had really identified that gap. And that fact that the solution is not something very elaborate, it's not a device or some kind of a technology that is going to take years to develop or something. It's simple, it's basic, and most importantly, it's effective. So that was my first point of due diligence, like assessing the need and how the solution fits the problem statement. And after that, it was easy going. When you are with a team who knows to identify the problem, can design something, then it's a no-brainer and an easy due diligence. So yes, we do have to evaluate companies pre-revenue with where financials don't look pretty, which goes completely against all the principles I know as a finance person. But it's the risk that general partners take. It's what we do in the VC industry, especially in health tech. So once I crossed my mindset barriers and I had the data from the market, there was like no looking back. Honestly, it was an easy go after that to do this investment.
Terrific. It's great to hear. And from the team's perspective, from Elemeno's perspective, and that's a question perhaps for everyone, how did getting the investment, going through raising money and finally getting capital, having capital to then scale, could you speak about that journey, the journey of not just working with clients, hospitals, clinicians, but working with investors, what those relationships were like, and how did it impact the growth?
Yeah, I say, Arup, you and I could probably both take this one a little bit. Arup in the early days, and it's as a founder, I'm sure, Arup, you can talk about getting that first dollar invested is always quite a challenge to be able to do that. If you wanted to take it from there.
Yeah, the very first dollars came in. from the people who know and trust you the most, but may not know the industry the most. That's your friends and family. Okay, there sounds like there's something there. And then we started to bring in a few investors who came from healthcare. Launchpad Digital Health was one of the early ones, and then also the Global Health Impact Network. Having a investment from this particular fund was particularly affirming from the sense of, hey, we're trying to solve a problem within healthcare. And we claim that, hey, we've got empathy for the problem when we understand it. Having an investor who is looking at us from the point of view of understanding that problem, like what Chital was talking about, and having there from Gary and then Bob Sweeney as well, who is an early partner in the fund, really understanding the need for education that at the front lines and how that relates to healthcare, seeing that value in the market was key. That was a great affirmation. So from Global Health Impact Fund, we got money, but that was also an affirmation that we were tackling a problem the right way. When we got funding early on from Y Combinator, that was for us, we didn't feel that they had deep knowledge in healthcare, but they certainly had deep knowledge in how to engage people and having their belief in our business also. And they brought not just that belief, but they brought intelligence for us in how we could set up the company and all the various resources we needed to get this going. Those are the value I had from those particular investors. There were a lot of other investors who came in and, hey, it's just money. So we're getting money in and we need capital, but they weren't really the quote unquote smart investor until we had then our lead VC come in. And I think Tim can speak a bit more about our experience with SJF Ventures.
Yeah, absolutely. And just to reiterate, there's so many different ways to raise money. And sometimes you just need to raise money and get things going. But I think being able to have people that really believe in you is key. And I think what's really interesting about global health in particular too is when I joined the company, being able to talk to Gary, Sheetal, Bob Sweeney, like others, to be able to talk to them and have a clinician-backed investment fund is really unique. And to be able to have your support, I think, is extremely valuable to us, whether it's introductions, being able to understand the problem space acutely, being able to have other investors like SJF that Arup mentioned, who's been able to help us lead a Series A and be able to help us from a financial standpoint, and the strategic standpoint is also great. But I think, Anna, your question about being able to navigate it, it's great to just have a community, be able to have so many of the people that do believe in you and believe in you to a point that they're able to write a check is great. But being able to make introductions, being able to open up your network, being able to do those sort of things that Global Health is able to do, that's a huge value add. And that's something that you can't quantify with just the dollars into the company. And that's something you're going to see in PitchBook when you look at the company and who's invested, but you are able to measure that when it comes to in a much different way with the customers and the introductions. And also then the thought partnership to be able to talk to people that do have clinical backgrounds that are able to say, hey, have you thought about this? And these are the things that I've experienced. Really valuable. So it's great to have a partner like Global Health.
Terrific, thank you. And thought partnerships and the network and the community of clinicians was something that was central to your vision, Gary, when building Global Health Impact Network. So could you speak about the relationships between the network and the fund? And what does that process look like once you invest in the company? Maybe just from the early days of diligence all the way to value creation.
Sure. It was actually, and my was 35 years leading up to it, right? And having spent roles in every hat that I could possibly wear as a serial entrepreneur, as an informaticist, as a practicing clinician, and also playing administrative roles. It all came together to the point where when I did create the network and the fund, exactly, it was for that reason, because it was quite obvious. And healthcare is a difficult space. It's a difficult sales space, commercialization space. It's the customers are tough. And as Arup pointed out, sometimes their incentives are not as aligned as you would like them to be, or what would naturally you would think it would be. And I had experienced a lot of that from a CEO perspective with my companies. So for me, it was the desire to create this ecosystem, this network environment, which created a safe, secure environment for health professionals. My whole career has started out with doctors, then it was doctors and nurses with my companies, then it was doctors and nurses and other health professionals, and then the network and fund was focused in on health professionals. What's a health professional? It's a professional who's focused on health. That could be a lawyer, that could be a CEO, that could be a clinician, that could be an administrator. It was less important because all of those pieces are required for success as you move forward, especially from a startup. But at the end of the day, you need money too. And the other thing is that after 3 times a serial entrepreneur, one thing I was exceptionally good at was raising money from my colleagues, because I'm to the point where they were probably very sick of me at some point, because every time I got in the or went to the doctor's lounge, when I'd walk in, they're like, oh God, what has he got today to talk to us about? And I was always constantly evangelizing and pitching about technology and about healthcare and how we can improve it. But it helped me develop that network. But at the end of the day, if you want to get any clinician interested in anything, you have to give them 3 things. And Arup, you'll crack up. It's lunch, a free lunch, CME, which was my first company, and then an opportunity to make a really good investment, but from a trusted source. Because as clinicians, we're always being inundated by potential opportunities from investment companies, yada, yada. And at the end of the day, we're also busy being clinicians. Most of us are not really trained to be CEOs or great investors unless we put our effort into it, right? We certainly have the intellectual ability to do it. But the opportunity to invest, well, if you look at a model where I said to myself, okay, let's do a venture fund, and I had never raised a penny from a VC with any of my companies. I didn't even know how to start a venture capital fund at that point, but a venture fund was the perfect environment to allow all these health professionals, who mostly were accredited, to come into a place and not only make an investment, but actively participate from early idea generation all the way through commercialization and exit. And that network is so hugely valuable to the companies that we work with, because these are the customers at the end of the day, and the ones that have to be happy with a lot of the platforms that we look at. So why not get them involved very early on, make them available to the companies, and then utilize them post-investment as what I'll call portfolio facilitation, because now we've got close to 3,000 clinicians that are associated with major hospital institutions globally. From a commercialization perspective, they can help with an introduction for the technology. Many of them are informaticists on our network. So it really is a natural fit for the companies to help the companies do what they need to do. And it's grown over an 8-year period. So that's where the fund stepped in. And a little bit of divine intervention is always very lucky. And my third company exited for a substantial amount of money right at the time that we started the fund. So I had a lot of very happy clinicians who rolled their money into our fund. So I didn't have to spend much time raising capital. As a matter of fact, I was trying to build the network utilizing the fund, and we're regulated by the SEC because of the number of investors you can have in a fund. So we stayed under 10 million just to have 249 investors versus over 10 million, which was 99. And I was spending most of my time convincing my investors to give me less money so I could have more investors, which was, I've never done that again. It was hysterical. So it was very funny on the fund side, but that network environment quickly gave me the substrate to create the network. And then a little bit of divine intervention happened again, because I went to a Society for Physician Entrepreneurs meeting. Many of us know Uli Chetapalli and Arlen Myers, and that was early on. And they heard what I was doing, and they said, you got to come and pitch this to our local chapter, which was in Silicon Valley. And I did. And I met the gentleman who built our proprietary platform at that meeting, because the idea of building a platform that had the functionality of LinkedIn, Slack, Dropbox, and Zoom was a nightmare at best. And they had already built it for Tata Industries. So that gave us that push to get the network up and running very quickly and start to build it by fostering collaboration, active participation by the clinicians at their own pace and helping us. So it really was a natural fit. And again, you know, what Arup and team have created here really embodies that whole process, because, and again, I didn't mention it before, but one of the other reasons that I created this is that I was one of the crazy ones, clinicians who started 3 companies. So I was a rarity. And clinicians, when they first start a company, there's a lot to learn, but there weren't a lot of resources out there for us. And when I saw that Arup, a physician, was the head of this great idea, it was like perfect because now we could actually work with a RUP and provide resources even to him as a physician to at the very early stage of an idea pre-MVP to build it out and be successful with the input of clinicians that have already done it before. So it really was a very important investment for us on the network side because of who Arup was and what he was building. So we're really all just, it fits together and it continues to grow on that same premise as we grow globally now.
Amazing. Thank you very much. And speaking about growth, I'm glad that's a great segue, Nick, to you leading growth and partnerships. Finally, on to you. What have you seen so far? Obviously, the platform had evolved. Tim mentioned that there are over 100 hospitals that are using it. So what are you seeing in your role? Like, how is it impacting clients? What are the use cases you're seeing? What are you excited about on the growth and partnerships today?
Yeah, absolutely. Thanks. Yeah, today we're seeing Elemeno really being used in the clinical environment as an operational enablement system for the frontline teams. So our customers are using Elemeno for a variety of use cases, whether that be orientation and onboarding, supporting skills day, QI initiatives, regulatory readiness, staff communication, just-in-time job aids, a lot of different use cases packaged into one platform. But the common theme across all of these use cases is that we help organizations move that critical knowledge out of the binders, the PDFs, the emails, the shared folders, and into the hands of the frontline teams in the moment so it's all actionable. And you heard Arup mention this earlier, but we often share that Elemeno helps close that gap between policy and practice because health systems are really aligned on their policies, procedures, protocols, those best practices. But the challenge is getting those standards to be adopted consistently across units, across shifts, across different locations of a health system. So Elemento really helps close that gap between what the organizations know should happen and what actually happens on the front line. So that's where we're creating value and seeing a real impact, taking that institutional knowledge, converting it into actionable, bite-sized support that the frontline staff can actually use in the flow of work. So from an impact standpoint, we've seen amazing results, and we really lead with, and Arup mentioned this earlier too, with a clear measurable ROI with all of our clients. So we work with systems to identify where Elemeno can help drive that hard cost savings and the operational value as well. Things like shortened orientation time, reduced in-person training for skills day, lower backfill and overtime costs, increase educator efficiency. We typically project out a 3 to 10x ROI with all of our clients and have really strong proof points to back this. One client saved 40% on their orientation times, and one unit alone saved $850,000 on an annual basis. So there's some real money behind this. If you can imagine projecting that out across the system, we consistently see 7-8-figure ROI figures for our clients. And a really important point too is that I think Elemeno is not really just solving a narrow education problem. We're solving a repeatable operational problem. How healthcare organizations can translate those policies, the best practices, leadership priorities into that actionable, consistent frontline action. I think what we're really helping to do at the core is helping frontline teams know what to do, know how to do it, and how to find that answer very quickly. And it gives leaders a scalable way to standardize and measure, sustain those best practices, and of course, generating that financial ROI return as well.
Thank you very much, Nick. And Rup, I'm just curious, now you are more involved on the strategy side from those early days of your initial vision and very personal experience that informed why you built this company and that motivation to where it is today. It's strong traction, addressing problems, working with big hospitals. How do you think about strategy? What is your vision? How has it evolved over the past years?
I have a vision of always trying to be able to take this global. So what would big success look like? That is like a physician, as a clinician, how do we help people like us caring for others all around the world, where so much of the world, the most complex piece of technology they have, the only piece is this one that I'm holding in my hand. So through the cloud, we can democratize access to that information, and through multimedia job aids that are not just based on text alone, we could easily start to localize information quickly to other areas. I imagine, like you talk about the Global Health Impact Network, I imagine this having a global health impact. to be able to go outside the bounds of our country. We just, as an example, we've signed, we haven't officially announced, so I don't know if I can give the name of a major company in the pharmacy automation space. They're a global company. We are partnering with them to extend what we're doing into pharmacies, and that's going to open us for our first customers outside of the United States. And we're looking to that for not just North America, but into Europe and beyond. We have also looking at our mission of serving those in need. And at this time of where we have such great political divide here, we are pleased to see that our hospitals are sharing practices, not just between public and private or urban and rural, but also between blue states and red states. It doesn't matter. We're all ultimately trying to achieve the same thing. And super excited about opportunities that are opening up now with the Rural Health Transformation Program, where there's funds coming to be able to support smaller rural hospitals in transformation of their operations, like how Meaningful Use had accelerated the deployment of the EHR. How could this accelerate deployment of our technology to these very low resource settings and let them leverage the knowledge of a shared community of national providers? So that idea of extending out to rural America, extending out across beyond our borders to other countries, those are exciting to me. And also exciting is Nick just said, all right, we've got this policy to practice gap in healthcare, but we've caught the attention of pharma now too. Because in pharma and clinical trial development, they've got a gap between protocol and execution. It's the same story. High risk, low frequency information. How do you put it in the hands of people who don't have much experience with it so that they can do it? So we've already started some pilot work in that space as well. So there's places that I've always wanted to go, and there's new places that have emerged that I never thought we would go. So those are all really exciting.
And Tim, on your end, how do you translate that big vision and strategy into some commercial targets? If you could speak about that experience, and how do you work with investors? I think that's a question both for Tim and Sheetal. What does the next stage of growth look like, both from commercial milestones and potentially just the capital needs? How do you both think, interact, partner on the next stage? And of course, thinking about the long term, what are the exit pathways for a company like Elemeno? So starting with the
Yeah, happy to. How do I work with Arup? Wow, how much time? No, he's got great big vision, which is awesome. And being able to like put that into execution is, I think, the great partnership that Arup and I have been able to establish.
He's got to rein it in and focus. That's what he does.
Yeah, exactly. There's a taser. I love working with Arup. And I think like with this big vision that we have, what's great is being able to, how do we break this down into the different markets that we're going after, and how do we focus with still being a smaller company, and how do we attack that? Arup mentioned a partnership that we're excited to announce, and I'm glad Arup didn't announce it yet, as we're about to do a press release for it. But we've got to stay tuned for it. But we've got a great way to use some channel development to be able to execute on this, and being able to leverage that, and being able to look at how we continue to go from that point of view, where we're going, and looking at where we're at right now. We've been able to start to morph the company into being a capital efficient type of business. And so when we look at future investment needs and these sort of things, we're at a kind of flirting with a break even profile right now, and which puts us in a nice spot to be able to look at when do we want to bring in capital? How do we want to raise that? And not being in the point where we have to raise or where we have to do these things, but we get to opportunistically do that, which is something that we're evaluating on how we want to move forward. I think with being able to translate the vision into market successes, though, we're looking at being able to continue down the path of being able to go through working with our hospitals, working through that channel, being able to start to explore how do we move into the pharmacy, like Arup mentioned, how do we move into working with other manufacturers that have a very similar profile to what we're doing, and then how do we start to explore other types of industries inside of healthcare, like home health and home care, that have frontline staff needs. I think using the word frontline staff is in frontline in particular is important, because there's nurses that are absolutely on the front line inside of health systems, but there's nurses that are on the front line inside of homes. There's home care aides. There's folks that are working in various ways that our approach works. And people like to be able to use the type of technology we have when it comes to training, when it comes to solving solutions. when people ask me like, what is a micro learning solution? What does that look like? I think we all do this on a daily basis. I know when I work on my house on the weekends, it's like I'm trying to micro learn really quick. I go to YouTube. I go to now pick your Chat GPT, your Claude, these kind of things. You try to have tools that are able to help you learn in the moment or be able to help remember things in the moment. And that's what we're trying to do. And so looking at all those avenues that Arup was talking about, where we've got potential to explore and potential to expand, the philosophy, the systems are the same. The software is the same. So we don't have to create new product. The product is there, and we're able to take that to these fronts, to the pharmacy, to the home, to the continuing to double down on the hospitals. And so that's the exciting part, is that we're able to take a lot of what we already have and continue to just apply it into new segments inside of healthcare.
Thank you.
So now keeping that perspective in mind, and also how the VC industry goes. We invest in companies, we would like to see an exit in a few years. And yes, all of us, all the VCs love a 10x, 20x, 30x exit. Those are the numbers that are tossed around. But we have to also understand what was our original vision of when we started our fund and network. It was definitely to make a difference in the healthcare systems in a small way, but in a substantial manner, in an efficient manner. And that is what Elemeno team is doing. Right now, they have the expansion plans that we are listening in. Now, yes, it is possible, and one VC would be say, this is a great time. You guys are coming, you all have great revenue, you're coming close to a break even. You should look at an exit. But here is where I would stop, and I would rather sit down and have a chat with Arup and Tim. How are you looking at this? If we are coming close to a break even, would we really get the right valuation, or should you go ahead a little more? These are some of the financial questions. Secondly, the work they are doing, we don't want to interrupt it. We don't want to change. Sometimes acquisitions are great. Yes, Elemenos goes to a strong acquirer and this is taken on a much bigger scale. Great idea. But then for that, first, it needs to be firm with all the new avenues they're exploring. The business needs to be stable so that when an acquirer is look at their perspective, they're looking at a profit generating business, which is making such a big impact. So the next step should be to take that impact at a much bigger level and not really make so many drastic changes that it kills the core of the concept. That goes completely against the principles of what we are trying to do. We may get a 20x exit, but if the acquirer is going to kill the core of Elemeno, that is not what we want. So it is a balancing act. Definitely, I would love for them to reach the break-even point, maybe raise a little more capital, bring their new partnership to fruition, and then look for a good partner. I'm not going to use the word acquirer at this point. It is about looking for a right partner who can take Elemeno to the next level. Or honestly, I'm going to throw the words out there of an IPO, but then that is something I'm going to get, and that I'm putting them in a spot like, hey, do you read, or should we go public? But that's a question not for today. I think it's after a few years.
Gary, you wanted to build on that?
Oh, and now I'm clamoring. Okay, yeah. So one of the unique concepts of our network and our fund and our approach, and the reason we have the word impact in our name is, and the points have been brought up by everyone at the Elemeno side of things, is we pride ourselves, and I pride on what we've created ourselves on, enabling companies to globally commercialize, and not necessarily just to scale the company and make more revenue, but to make technology and resources available. And the term I use, Tim, is it's the first mile point of care, what you were referring to. But in the US, yes, that's the senior living facility. That's the home of the individual. There's a lot of different first miles point of care. But globally, sometimes that's a community in Africa that doesn't have anything else, or they have no resources to tie to. And again, what the incredible data value that you're bringing to the table is this database of ways to practice excellent care delivery from systems where it's quite obvious that it's a successful model, larger systems. But that can be condensed down in a way to be made available as a solution for the delivery of care in a small community with no access, Africa, and then places like India, where clearly the market is very similar to our market. So one of the things that we've done in the background is we have a network of communities, and the communities aren't all clinical. They're all based on, so if you look at a company going from early idea generation, marching through milestones as a startup, okay, and having to achieve certain goals to reach those milestones, to get to the next milestone, there are capitalization issues. And then there are growth issues, and then there are also developmental issues based on the needs, the unique needs of the new clients that you're bringing into the concept. And then you brought it up, right? From a scalability perspective, and this is where you make Sheetal, the CFO, happy, is being able to look at other addressable markets, which may be healthcare, may not be healthcare, but there are areas like, I love the fact, and I won't talk about because I have some info about what you're referring to, even in the pharmacology space. There are ways to deploy this platform that benefit other parts of the healthcare industry that are not necessarily just policy and procedure, but it's the tool, the engine that you built that's the real value. So for us, we're always pushing our companies to not only achieve growth, but achieve growth in a way that addresses the impact needs. And that doesn't necessarily mean a lot of increased revenue, but it's certainly a lot of increased commercialization of the product, which then can lead in different ways to revenue. So that's our approach. So we're very unique as a quote unquote venture capital organization in that we're not only focused on the mighty dollar, we're focused on what we're trying to accomplish from a global perspective and a healthcare perspective. So that's very important to us.
Thank you very much, Gary. And we have a few minutes left, so we can open it to the audience of the webinar. If there are any questions from the audience, you can just type them in the chat. But as those come through, I cannot help myself but ask, of course, how are you using AI? The world is different. I think we're all spending a lot of time with I personally spend a lot of time with Claude. I'm sure there are many use cases, and you're seeing it in different parts of your business, whether it's growth, product, just synthesizing some of the insights. But if you could share some of the examples, how this really AI adoption over the past year, and maybe even more so over the past 6 months, have impacted your company, I'm sure there are folks in the audience who would be curious to learn as well.
Absolutely. I thought maybe we were going to be the first webinar this year to not mention AI. Like that was going to be. But yeah,
well, I will say, let's use the machine learning word.
There we go. There's a whole spectrum there. Yeah, for sure. I think there's a couple ways that we're specifically using it. One is that we are incorporating it into our team. Our team uses this to be able to help create some of the content and resources in partnership with our health systems and with our different types of clinicians. And so we use it right now, which helps us to be able to develop our product in a much more efficient manner and helps us to be able to deliver value quicker to our customers. And so that's something that we're using that's also helped us from a financial standpoint with our gross margins to be able to have those move in the right direction. So we're using it internally. But I think more importantly, we're incorporating it into our product. And we have some releases that we've been able to do that's helped with our customers being able to use AI to be able to help with some of the self-publishing capabilities that we have. We're continuing to look at being able to get this more into some of the new releases that we have. They're going to help people with managing things like their shift changes and being able to look at us being able to fully become a more operational platform and not just one that's focused on micro learning. So we're looking at AI as something that's a enhancement to our platform, something that's an enhancement to our employees, and being able to look at it that way. There's ways that people look at it as a threat to software businesses. We don't look at it as a threat. We look at it as a way that's going to be a force multiplier to be able to have a small company like ours be able to continue to develop and really have outsized impact with our customer base.
Thank you very much. I think we have one question from Max Padlon in the chat, which is the origin, meaning behind the name and how it was chosen. Arup, to you.
Okay, I'll try to do that quick. There's a little Saturday Night Live piece that comes into that too in the history. But so when my co-founder and I started the company, we needed to have a name. And we were thinking about the different values that we had here in the company. And at the same time, our kids who were in middle school at that time had a project of where they were to cross over between science and English, taking the periodic table of the elements and looking at them like Scrabble tiles and trying to see what kind of words you can make with it. What's the maximum number of words you could create? And so that had us thinking about what are the elements of what we do and how they may fit together. And of the core elements, we had the idea of elevating quality. So that's where the EL came from, empowering the front lines with knowledge, from engaging us, EN, as an interprofessional team. And when my co-founder was out on a run, he was thinking about this, and he recalled a skit by Dan Aykroyd in Saturday Night Live going way back to the late 70s when the US was trying to go metric. And at that point, while you still see on the highway sometimes the kilometer signs along with the miles on what the distance is, like driving to LA. But at that time, as the US was trying to go metric, Dan Aykroyd was the lead for the Department of Weights and Measures. And he tells the story about how we're going to simplify the alphabet from 26 letters into the decabet. It's going to be 10 letters. And as he ran through the letters, one of them was, you think about how the kid says and you sing song, it's an Elemeno. So we put that together with our elements, and all of that came together to create Elemeno.
Amazing, wonderful. Thank you very much for that memorable story. And in closing, I know we have quite a few webinar guests. Many of them are members of the network. Many of them are clinicians. So the ask for the team is, how can the network support you today? What are the key needs, perhaps starting with team? Where can a network really step in to help you get to the next milestone in your journey?
Yeah, I love that question and love everybody joining and being so supportive, and love the support that we've gotten through the network. Biggest thing for us is introductions. We're in a growth mode right now, being able to make introductions into health systems, specifically anybody on the operational side of a health system, a chief nursing officer, a CNO, any kind of introductions that you have there is great. But also outside of health systems, like we talked about, these other verticals that we're doing inside of healthcare, if people in home health, in home care, in manufacturing, in pharmacy, any introduction that you think would benefit from the type of approach that we've developed here at Elemeno, we would love. That would be the biggest ask that we have. And if nothing comes to mind right out of the gates, the next ask would be follow us on LinkedIn. We're trying to continue to have a nice impact there. LinkedIn is still very relevant in our world, and being able to engage with us, being able to share all the kinds of things that we do, that would be fantastic. So those would be my two asks.
Wonderful. Thank you so much. We're almost at time. Very grateful for everyone's time. We'll be looking out to that press release that will be coming out from the team later this week or perhaps next week. But congratulations on the journey so far. And thank you very much for your time. Have a wonderful week.
Thanks. Thanks, Anna. Thanks, Gary. Thanks, Shital. Appreciate it. Thanks,
Thank
everybody.
you all.
Thank you.
Bye.
Thank you, everyone.